With the local elections coming up this Thursday, we'll be talking about that after 9. But right now on the show, we talk dentists.
BBC Essex.
And when was the last time you went to the dentist? Are you struggling to see an NHS dentist? Do get in touch. This is something we've touched on before on The Breakfast Show on BBC Essex. It continues to be an issue in our region and in our county. What's been your experiences? Because a dentist in Southend says he won't be able to continue taking on NHS patients without receiving more government funding. Dr. Nilesh Palmer is the owner of Palmer Dental in Leigh-on-Sea and has applied for more financial support, but hasn't heard if he'll get it. And Dr. Nilesh Palmer joins me now. Nilesh, good morning to you.
Good morning, Sonia. Thanks for having me.
You're welcome. Thanks for coming on. So tell us a bit about this situation then. You're trying to get some more funding. What's going on?
Yeah, Sonia. So dental practices have a set quota. So NHS clinics, they'll be given a set sum of money which corresponds to a certain amount of NHS dental treatment to do. The practice that I recently purchased in Leigh-on-Sea had what we call a fairly small contract. So it had about enough NHS funding to sort of service one dentist. And we know that Essex has a really high need for NHS treatments at the moment. It's ridiculous how high the demand is. So we totally refurbished the practice and we now have 3 full-time NHS dentists there. And obviously these 3 full-time dentists are ploughing through the quota of NHS work we have. So by my sort of projections, I think by the middle of the year, maybe just after summer, we'd probably run out of our NHS quota. So we'd have finished the amount of NHS treatment that we're allowed to do. So we've been asking for some more funding. Obviously, the local authorities are very, very understanding and they're trying to get more money. But it just seems like a crazy situation where you've got a clinic which is ready to do more treatment and do more NHS work, but we're going to have to stop because we just don't have the funding to do it.
And you've obviously gone through the processes to try and get that, but you just haven't heard anything back, no? You don't know where you're at with it?
Yeah, it's quite a tricky process. So you have a set contract, we call it. And to get more funding, you can apply. Sometimes the commissioners will put out an email saying, right, we have this amount of extra NHS work to be done. Who wants to do it? And then either it's first come, first served, who's most suited to do it. Whereas if you think back, I think just when I qualified in 2004, Sonia, you could do as much NHS treatment as you wanted to do. There was no limit to it. So as an NHS dentist, you were sort of almost allowed to do big treatment. So patients who come in with lots and lots of decayed teeth, you're paid a reasonable amount to do good quality treatment. And it just seems crazy to me that if dentistry is healthcare, it's almost like saying to a hospital, you can see 300 patients this year. And once you've seen 300 patients, you have to send them away. And that's exactly what we're having to do, because dentistry as a whole, the way NHS dentistry has been designed is it just doesn't work. And the patients are saying it doesn't work because they can't find NHS dentists. And the dentists are saying it doesn't work because they're not willing to work on the health service. So the government sort of needs to wake up and sort this mess out.
Yeah, and we've spoken before about more dentists moving to private because of the current setup. How do you think it should be sorted out?
So personally, I think they need to bring back what we called fee per item, which was if you did 1 filling, you got paid for 1 filling. If you did 10 fillings, you got paid for 10 fillings, which I think makes sense. At the moment, if as an NHS dentist, they do 1 filling or they do 10 fillings, the amount they get paid is the same. There's no difference to it. And if you look at the modern high-tech surgeries that we've installed, they cost about £200 to £300 an hour to run, just to keep the lights on, to do all the registrations. And that works out to doing about 10 to 15 NHS checkups an hour. And it's a crazy number of patients to see just to break even, which is why so many practices are offering Invisalign, private treatments, bonding, because without that private component, these practices would go under. They just wouldn't be able to support themselves financially as a business. They would go under. So I think the government needs to wake up and think, right, if we are serious about NHS dentistry, we need to get serious about the funding for it, because the demand is so high and the funding hasn't increased with it. What the government have said, so they've said we've got dental reform, we're going to give more money to dental practices. I mean, I own 2 NHS clinics and we've not seen anything. So it's something that really needs addressing, as opposed to just putting a band-aid on it every 5 years and there's an election.
Yeah, let me read you the statement that actually we got from the Department of Health and Social Care. They say the new patient premium is automatically paid to dentists when they see an eligible patient. A dental recovery plan, which I think you touched on there, will create around 2.5 million more appointments this year alone. As a result, more dental practices are already accepting new adult and child patients across England. And they say we're supporting dentists and making NHS work more attractive, including by providing cash incentives for practices that treat new patients, introducing £20,000 golden hellos to encourage dentists into underserved areas. We're also continuing our work on reforming the dental contract so dentists are paid properly for more complex work. And I saw you sort of touched on a couple of the themes there, but give us a sense of what you think about that statement.
So, number one, they classically haven't touched on the main problem, which is we're running a quota-based NHS contract. So if you're telling me I need to see 1,000 patients a year on the health service, once I've seen those 1,000 patients or done that equivalent amount of NHS dentistry, what do I do? The golden hello, the £20,000 goal, was actually discussed on some of the dental forums that dentists belong to. And most of the dentists said, no, it's when you work it out in terms of how much extra it is per patient, and how long the hello is valid for. So I think it was valid for 3 years. It worked out at £3 or £4 extra per patient, which still kept it below that threshold to actually make it financially worthwhile. In terms of reforming the contract, Sonia, I qualified in 2004. This contract came in place, I think, 2006, 2007. They've been trying to reform that contract ever since then. Reform the contract are these words that dentists hear, and I think they want to shoot themselves because we just keep hearing it. I don't want to hear reform the contract. I want to hear, here's the new contract. And it just seems as if they are not willing to make the movements that they need to do to sort out NHS dentistry. And that's why I did a survey of 200 newly graduated dentists. And I think only 7% of them saw their career in the health service. So in 10 years' time, you just won't have any NHS dentists. So what are we going to do? We can't physically do the work. I think the government really needs to wake up and talk to the dentists, talk to the BDA, who've been working really hard to get this sorted out, but they've been banging their head against the wall so far. We really need a change.
You kind of anticipated my next question in a way there, because I was going to say, how do you think it will pan out? But you think ultimately, unless there isn't serious reform, it will be the end of NHS dentistry.
Correct, yeah. Already so many NHS practice owners are giving the NHS contract back. So they're saying, look, this isn't working for us. You even had a big corporate, I think it was Bupa, which gave back so many NHS contracts because they said this business as a business model doesn't work for us. So here are your NHS contracts. So we're going to move to a private scheme because we just can't make it viable on the health service. So that surely has to be a wake-up call. If a large corporate, which has economies of scale, has so much buying power for materials and goods, etc., can't make it work, how do small business owners make it work? It's something which defies belief. And I think the best analogy I had for the NHS quota system is just to compare it to a hospital and say you could see 500 patients a year. Once you've done that, you can't see any more patients. And surely that sounds absolutely ridiculous to us. Yeah. So why are we doing that to NHS practice owners?
Yeah, and behind all of these, reforms and contracts and policies and money are people who are sometimes in a lot of pain or need a lot of work. And I guess you're seeing that. And we've certainly heard stories of people who can't get access to NHS treatment and they're in a lot of pain.
Yeah, and these patients, they've got so many problems. They need so much work doing that. If I give you an example, a molar root canal treatment on the health service, on the NHS service, works out, I think the patient pays about £70 for NHS molar root canal treatment. Now, for me to do a molar root canal treatment properly, or to do it to the best of my ability, I need to wear loops or magnifying loops, which cost about £5,000. The surgery costs £300 an hour to run. I've got to pay my nurse. The files that we use for root canal treatment probably work out to about £30 per patient. So if you're telling me you're going to pay an NHS dentist £60 to do it, when the cost to do it to the best of his ability is way beyond that. And the other thing you have to remember is that £60 or that one-off payment covers all the root canals, all the extractions, all the fillings that one patient needs. So it's an insane loss that the practice would make. So patients saying, we can't find NHS dentists. It's because if you did have NHS dentists doing all of that high need treatment, your dentist would close down. They would just be working out a loss. Think of Sainsbury's selling you your weekly shot for a tenth of the cost it actually costs Sainsbury's to do it. So it isn't just feasible, and the government really need to wake up, and these sticking plasters and reforms and handshakes just don't work. The actual scheme itself, the contract itself, is flawed. So for me, you need to pay the dentists for the treatment they do, not try and put it as an umbrella, and don't give them quotas. Quotas never work well for anything unless you're talking about food or production, when you're talking about non-human based services. When it's healthcare, you can't put quotas on it. It just doesn't work.
Well, Nilesh, all the best, and thank you very much for coming on, talking about it this morning. That's Dr. Nilesh Palmer, owner of Palmer Dental in Leigh-on-Sea. It's 16 minutes past 8. Let's bring you up to date with